muscles are attached, and you look at, you know, why are you allowed passive range of motion first? You're usually allowed passive range of motion first so you can move the capsule, so the capsule doesn't tighten up and thicken up, and you end up with a secondary frozen shoulder type of thing. Next, you're allowed to do active range of motion because the muscles will pull on those fractured sites, and now you're more stable, right? And then you're allowed to move. And then usually it's after 8 weeks, right? Six to 8 weeks, you're allowed to start gentle PREs, but around 12, greater than 8 to 12 weeks, you're gonna start to be allowed to do PREs, right? Progressive resistive exercises stuff, because there's continued healing, and you're allowed to do weight bearing. You're allowed to do more dynamic types of exercises, like the throwing stuff. Those are very dynamic in nature. It's a stop and go force of throwing, plyometrics type of things, weight bearing. They're allowed after 3 months. And that's just general, like bone stuff, right? But it doesn't necessarily mean anything, oh, it's only this bone or this fracture, right? So that's how you can kind of like rule in and rule out what you're allowed to do, right? And then when you get to arthritis and rheumatoid arthritis, then you have to know, okay, well, what are you allowed to do? Because what is arthritis? What is arthritis? Arthritis is basically bony changes, right? This is bony change, right? And then rheumatoid arthritis is actually bony change plus soft tissue types of issues, right? So, and here the bone changes, but the bone changes because the cartilage that is around that bone has changed. So it affects how the arm moves within its socket, within its joint, right? So, but with RA, it affects soft tissue as well. There's capsular issues, there's labrum issues, there's tendon issues, right? With OA, the change that you're going to see here is that active and passive range of motion are the same, right? So if someone has like a hard, you know, change in their humeral head, passively they can only go so much, and then actively they can only go so much, right? It can be related to trauma, it just be related to age, genetics type of stuff. And then you have rheumatoid arthritis. So rheumatoid arthritis, as we know it, is an inflammatory process. The body essentially is attacking itself. So, you know, this is the same as if it was in the wrist or the elbow. It's attacking its own joint. So then what can happen? Not only are there bony changes, cartilage changes, but there's a lot of diffuse inflammation within that joint, right? Which then affects the capsule, it affects the labrum, right? So the capsule is made of ligaments that hold everything together. And then the labrum is just that build out of the glenoid fossa, right? And the tendons, it's really, at the end of the day, it's the rotator cuff tendons that get really torn down by this, because if the shoulder isn't moving well, then you're just going to keep hitting and rubbing and causing a lot of problems to those tendons that hold the humeral head together, right? So that's why you're going to see both bony and soft tissue types of injury. And with RA, what you're going to see with RA is there's a difference between active range of motion and passive range of motion, right? So it's a bony problem, but soft tissue type of problem. It's usually like a pain type of problem. So actively, they might not be able to get that much just because there's a lot of weakness. The joint's not sitting in the right place. Maybe you've torn through some tendons. But passively, you can move them and they don't have a problem. All right. But because of this, You can have changes, damage to the rotator cuff. Now, in terms of treatment of all of this here, of these two here, right? You can have one, you can have conservative treatment. That's us, that's therapy. Two, you can have a debridement. Then us, that's therapy. And then I'm gonna write up here. Number 3, you can have a Hemiarthroplasty. So hemiarthroplasty is just like saying half of a total elbow, total shoulder, right? So basically, they're just removing the head, the ball. The socket remains there. They're gonna remove the ball and put in that replacement. So it's half a replacement.
Hey therapy friends, it's Huang here. Thanks again for watching my video. And if you like videos like this that can help you just crush it in the hand therapy world as an occupational therapist, then hit the subscribe button and enjoy the video. Thanks again for watching.